Good afternoon. I wish I could be with you to say thank you to each and every one of you for what you do. Paul Bridgewater, thanks for always being there and being such a great CEO. To all the elected officials, thank you for caring and supporting this really important agency. You know, all that's great about our nation today is a tribute to past generations, a tribute to the men and women you serve every day at the Area Agency on Aging. And I know we have many challenges to make sure we are really serving them today. Over 500,000 seniors living alone in Michigan, nearly half of them threatened by hunger, which makes no sense. And that means that Meals on Wheels and our other funding programs are so critical, bringing people dignity and the independence they need. And having delivered meals many times myself, I know it's a way to really reach out, spend time with someone who may not have anyone else to talk to during the day. So I'm deeply concerned about the fact that over the past 5 years, funding for Meals on Wheels and other Older Americans Act programs has been cut, while we're seeing more seniors in need of healthy food and wellness services, which are provided by your agency. It is so important to protect those programs, especially in the wake of cuts. I understand there are nearly 1,000 seniors on the waiting list for Meals on Wheels alone, and that it will take $5 million to meet the service gap. You know, unfortunately, here in the Senate, a budget resolution outlining the priorities for the coming year was passed a couple weeks ago on a party line vote. Not one Democrat voted for it. But it would have made things, it will make things, if it becomes law, even worse, providing fewer funds for Meals on Wheels, cutting Medicare by $430 billion and changing it from a guaranteed health care program to something that looks more like a voucher. Medicaid was cut by over $1 trillion. Nursing home care being the primary place where we spend Medicare dollars. Somebody who has Alzheimer's, somebody who has another nursing home need, proposing that we make Medicaid into a block grant back to the states. All of those things, as well as eliminating the things that we passed in the Affordable Care Act under Medicare to have no co-pays for wellness visits, and closing the hole on prescription drugs so that we're providing comprehensive prescription drug coverage. The only thing that stands right now between that budget that was passed by the House and the Senate and having it take effect is our president, who thankfully will be vetoing those policies. But it is very concerning to me that those things could even get a majority of the House and the Senate. That's why we need your advocacy and support, not only supporting what you do every day, but telling the story of the people you meet and why it is so important that we keep our promises to them. This July, we'll celebrate the 50th anniversary of Medicare. Medicare, which literally, along with Social Security, has lifted a generation of Americans out of poverty, created the ability for us to live longer, healthier lives, and create the opportunity for some certainty around medical care. This is important. It was a great thing to do 50 years ago, and we need to make sure we are keeping the promise of Medicare and Social Security on into the future. Thanks for all you do. So many different services, so many different ways you are making a difference. I'm very focused on Alzheimer's going forward and how we can support caregivers and how we can address the fact that 1 out of 5 Medicare dollars today is spent on the treatment of Alzheimer's. We have things we can be doing to create cures by focusing on research for the future. There's a lot in front of us. And I'm going to continue to work hard, and I'm honored to be your partner. Have a great day.